Thanks for the introduction. Hi, I'm Niloufar Saharkhiz from Elisa Konopoglu's lab at Columbia University. Breast cancer is one of the most common cancers in women, and about 1 in 8 women in the United States develop invasive breast cancer over the course of their lifetime. Mammography is the current breast imaging modality for breast cancer diagnosis. However, it has low sensitivity for women with dense breasts and also radiation exposure risk. Ultrasonography is useful for looking at breast changes such as lumps or ones which cannot be seen on mammogram. However, it has high false negative rate. To determine the extent of the disease and also characterize the type of tissue when cancer is suspicious, an invasive biopsy is needed. Ultrasonic elastography is an addition to a regular ultrasound image, which can differentiate different tissue types based on their distinct mechanical properties and the fact that Young's modulus or stiffness of the tumors is higher than that of normal tissue. Harmonic Motion Imaging, or HMI, is a non-invasive ultrasound-based elastography technique, which is consisted of 2 confocal transducers. The focused transducer generates amplitude-modulated acoustic radiation force within the focal spot, and the resultant displacement is tracked with an imaging transducer. HMI is capable of probing viscoelastic properties of stiff and deep-laid tissues, and since the displacements are at a specific frequency, it allows noise reduction in displacement estimation. The capability of HMI has been shown previously in our lab in HIFU ablation monitoring, tumor detection and characterization, and Young's modulus estimation. And for this study, we wanted to, for the first time, develop an HMI clinical setup to detect and characterize breast masses in human subjects. Here's a video of HMI displacement oscillating at 50 Hertz over time, and red and blue shows movement or vibration of the tissue towards and away from the transducer. The schematic shows the HMI system in the clinic where the HMI transducers are moved using a robotic arm in a 1D point-by-point raster scan. So basically at each point we acquired RF data to estimate the displacement, and then we moved the transducers to the next point. And accordingly we could reconstruct the HMI displacement map based on the displacement at each point. We have scanned 4 patients so far. 2 were diagnosed with benign tumors and 1 with invasive ductal carcinoma. Here are the images, B-mode images, and HMI displacement map overlaid on the B-mode image for 4 patients, where the color map shows peak-to-peak HMI displacement amplitude in micrometer, and the dashed rectangle is the region where the focal spot of the focus transducer was. For the patient with IDC, we also scanned the post-surgical specimen after mastectomy, and we found similar results with the in-vivo scan. So accordingly, we found that the benign tumors had lower HMI displacement compared to surrounding tissue, and the malignant tumor had the lowest displacement, and basically that's why we think that HMI has the potential to differentiate benign and malignant tumors. In conclusion, in this study, we showed the initial feasibility of HMI clinical system for detection and differentiation of in vivo human breast masses, and the acoustic radiation force was localized and strong enough to generate detectable displacements even in stiff tumors, and the total scan duration span within 5 minutes, so it did not delay any of the following procedures and or other medical care of the patients. In future, we want to focus on optimizing the current setup for real-time processing and also combining the setup with electronic steering to have shorter scan times. We want to improve the system accuracy to eliminate any potential effects of patient movement, and eventually we want to integrate the system, the setup into HIFU system for ablation monitoring and assessment of ablation in patients with breast masses. I would like to thank our funding resources, my colleagues at UEIL Lab and our collaborators at New York Presbyterian Hospital, and you for your attention.
Okay, any questions from the audience? Okay, yes.
For your HMI displacement maps, will you be correlating those to other elastography measurements that are in the literature for breast tumors and breast tissues? Or?
It's been shown that the malignant tumors are stiffer than normal tissues.
But will you try to correlate the subtypes or make sure your changes are similar to what's in the literature, or are you just looking at the change? For now, for the in vivo study we just started, it's just the displacement, like comparing the displacement within like the patients we have scanned. But we have previous studies in ex vivo post-surgical specimens. And I guess we did like look into other literature about the stiffness, which can like measure with other techniques. Great, thank you.
Maybe just a quick thing on your spatial resolution, because your competitor, let's say mammography, is very high resolution, mostly based on calcium. Now what you are seeing is very different. So what is this spatial? What can you say something about spatial resolution?
It really, I guess it depends on the size of the focal spot. So for this, the focal size of the focus transducer was about 1 millimeter. So it's pretty localized to look at like even very small tissues.
Okay, I think we, because of the sake of time, thank you.
Thank you.